My biggest turning point was when I left DNB Medicine seat.
One thing I wish every medico understood about mental health.
I have seen every person suffers from mental health struggles in MBBS or in residency. I was diagnosed with severe depression and migraine. We have to be mentally way stronger, right? Which is what I did. Salaah Shots, one of the very best platform where the Salahkars come and give advices. Many of the juniors really need that.
So, what was the most painful part of that phase?
I didn't know what to answer to my friends, what to answer to my society, mainly my father and mother, right? I didn't know that.
Welcome back to Salaah Shots podcast. Today's guest is a story of courage. Someone who read the toughest textbooks, faced depression and migraines alone, fought through the 46K rank, rose up to 800, quit a residency. Everyone told him not to leave. Worked behind the scenes in top coaching platforms and still chose to build his own path. From a peripheral medical college to PJMC pharmacology, from society's doubts to self belief. Please welcome Dr. Poojan, a medico who choose purpose over pressure. So, welcome, Dr. Poojan. How are you?
I'm good. Thank you, Sagar. How are you?
I'm also good. So, Dr. Poojan, for your listener who know your ranks but not your journey, how you do describe yourself beyond medicine and results?
So first of all, that's a great question. I would like to define myself. Ranks often become the headline, but they don't capture the whole story. Beyond medicine, I would like to describe myself as someone who is deeply curious and also driven to make complex things much simpler. And I would also like to add, like I love to build, whether it's a startup idea or it's an idea, or whether it's idea or it's a page or it's a startup. I would love to build things from zero. And also that entrepreneurial journey also helps in medicine. So if you take away beyond ranks, I'm a learner, a builder, and genuinely interested to build some things and to make life easier for a next person.
Okay, so let's talk about your MBBS journey. What was your approach? How many hours were you studying? Were you reading everything from standard textbooks? If yes, how were you revising from these standard textbooks one day before the exams?
First of all, I would like to clear that I used to study medicine not for getting good ranks, for getting the good knowledge, right? And I would, in my first year of MBBS, I have made habit of reading 3 to 4 hours daily. As you all know, the first year MBBS is quite hectic, right? We don't get much time. We go for practicals, dissections, and lectures. We need to attend compulsory somewhat. And I would like to go in detail. I have read BD Choris in a very good detail and somewhat chapters from Guyton, which were very good conceptually. And even in my exams, prof exams, we get 1 day holiday. We used to read everything, right? So I used to make crisp notes from it, and I used to read from the Guyton. Same way with pathology. I have read from Robbins' whole pathology, pharma from Kiri Tripathi, and my father is surgeon, right? So he has taught me from Love Bailey, right? He was interested in knowing about latest academics, and so he also used to teach me from Love Bailey. I used to ask him, right, will I be able to write from the exam because I was not confident, and he used to tell me just read this once revise it before the exam, you will get through it. And I know I have read GI, urology, from everything from Love Bailey 1 day before the prof exam. So
Okay.
I and even in medicine, I have read from Love Bailey. Sorry, even in medicine, I've read from Harrison. Right, Harrison is vast. Right, we basically can't read everything from the Harrison. Right, so I have read it, understand conceptually in a very detailed manner, and used to read from Marrow videos. So I've made my life much easier by reading conceptually.
Okay. So you told ki, you have prepared for the NEET PG in your internship very seriously, but you got 46K rank. What was that moment like for you emotionally?
Honestly, I started preparation in my internship, right? And my approach was way different from the others. Right? I did the biggest mistake that I used to read each and everything. That was my biggest mistake. I was not studying for the exam. I was studying before becoming a good doctor. But when you are studying for NEET PG like competitive exam, you need to be somewhat exam oriented, right? So I missed that part. And when the results came and the 46K rank, my whole my hands got tremble and I was so shocked, right? I used to study from all the standard textbooks. How can I get this 46K rank? So this was difficult for me. My father, it was difficult for my father, it was difficult for my friends too. So somehow I accepted it. This is the situation. And I was so disturbed emotionally, mentally, and everything.
Okay. So I just want to know your journey from 46K rank to 800 in INI. What were your strategy for getting this rank? Can you tell me?
From 46K rank, my results came in 1st of June. I remember that, 2022. 1st June 2022, and I had November I9 within 5 months, right? So I need to get a good rank. That was a real pressure from my side, right? I need to prove myself. That was the point. So I sat down. I started announcing my weak subjects. Which are my weak subjects, right? Which and first of all, I gave a GT, and the last three subjects, which I got in my GT, I used to make them as my I have made them to I had to take them this top last three subjects on the top three in my next GT. That was my main strategy. That was my main plan behind it, right? So I basically used to give GT every month till I9 November 2022, and I sat down. I wrote down my weak subjects. I used to analyze them, what my weak subjects are, what my weak topics are, and I used to work hard and I used to use custom modules like every day I used to solve 20 modules. First of all, I started my custom modules for a, just a, for each and every subject till 19 subjects for 19 days I used to do. Then I started custom modules for PYQ base. Then I started custom module randomly, and my aim in custom modules was solve to get 75 correct, 75% correct. That was my main aim in custom modules. And I used to also give custom modules 100 MCQs, right? And which was very important. Image-based MCQs I used to put my prompt whatever I want, right? So that was very important. Custom modules and GTs have taken me very far. And weak subjects like used to be my top priority. These are my three main goals I used to do. For Dermat, radio, anesthesia, psychiatry. These four subjects I can't get an MCQ wrong, right? I have made my mind. These were the scoring subjects. So I made my preparation in that way, strategy in that way. I used to keep my choti notebooks, slips. I used to keep everything in my pocket. I used to revise ASAP. ASAP. Revising is everything. Revise and just I did complete my syllabus in 2 months and did revision by 5 months. And did revision in 3 months. So total 5 months left. So I completed everything, and that was my main thing. Revision was everything, which I missed in my earlier exam, which I couldn't revise.
Okay. So how you used to keep calm yourself during your drop year?
Actually, I used to stay away from people which brings me down, and I used to keep my strong boundary lines. Right, I kept my very strong boundary lines. I used to meet people very less, socializing very less, but I used to go for a walk in the evening with my friends, and we used to go for a daily walk, means daily walk. That was my good therapy, like a dopamine therapy for me. And I used to somewhat started meditation, which may help me to stay calmer.
Okay. So consistency is hard when mental health is shaken. So how did you maintain momentum for your next INI-CET attempt? What strategy you used?
First of all, before May I9, there was a NEET PG, which was held in month of March. So I was preparing for NEET PG mainly, and I was ready to take a branch in this NEET PG only because from November I9 I was not sure whether I will get something which I want. I want at that time dermatic something. I was not, and was will not. I will not get. I know that. So main thing I used to study for NEET PG, and in NEET PG, 3 4 MCQs got silly mistakes, which I got again got broken, and I sat down. My ranks somewhat got diminished. My ranks were around 9K, and I took I took DNB Medicine, and after that 2 months was May I9 23, and May I9 23 was way tougher and was something very difficult, right? And there were MCQs which many of the people don't know. So I used the same strategy. I didn't change my strategy. The strategy which give me results, why should I change that strategy, right? So
Yeah.
I studied from the same strategy. And again, last three subjects, I need to make them at the top. Whatever MCQ has got incorrect, just go through that MCQ. Just go through that topic once. And I used to I used to, for example, give GT on Sunday. That was my fixed time, 10 to 1, very fixed, no change in that. And after next day, Monday, Marrow announces the result. And Monday, I used to analyze my whole of my GT where I got wrong. I used to sit around 19 subjects and used to analyze which and every question where I got wrong. That was my main strategy, as simpler as that. And I used to give test series like anything. And I have solved many of the custom modules and many of the even Q banks. I would solve around there at 8:30 at the time. I used to solve around 7:20 around. I have solved. So that was my main strategy. And randomly, when I used to get bored, I used to solve custom modules. Right? When I used to go for playing cricket somewhat, and somehow I got bored, so I used to solve custom modules. Custom modules are the main thing to solve.
Okay. So you told you joined DNB Medicine but didn't enjoy it. Why did you quit DNB Medicine? Didn't you like it, or what was the reason behind it?
I got admission at Aditya Birla Hospital, DNB Medicine. I love studying medicine, but day-to-day workflow didn't excited me, to be very honest. Instead of dragging something for 3 years and dragging to the same place, same thing, which you didn't like, so I decided to step back, reassess, and choose a path where I contribute more meaningfully, right? So I
Yeah.
really didn't enjoy my DNB medicine, so I quit that place.
So what was that most painful part of that phase? The judgment, the silence, or the fear of unknown?
All I would like to tell everything was I really I didn't know what to answer to my friends, what to answer to my society, what to answer to my family, what to answer to my mainly my father and mother, right? I didn't knew that. I really didn't knew. So that was a real pain. People won't understand us, but somehow I was firm to my decision. And many of people asked what will you do, but I decided to step back. That was my main thing at that time.
Okay. So you have told ki you have also worked in different platforms. So how did you working behind the scenes? As a content editor, you have worked there. So what was the work and how are you enjoying?
After completion of my NEET PG in March 23, I applied to a lot of jobs in Maro, in Prep Ladder, in Doctor Tutorials, where I got rejected from every of the platform. And afterwards, after 1 month, I got a job from DAMS. So I worked there as a content editor, and I used to see each and every MCQs, used to find out the mistakes and used to correct it. Right? That was my job, and I really enjoyed it because I was loving what I was doing, and used to create MCQs, used to create image-based questions, and which I was enjoying. So that was my main thing. After that, firstly I worked for dams for around 8 to 9 months, I remember, and then I worked for prep ladder for again 9 months.
Okay.
So after
So
quitting my DNB medicine, in 2 months I started working for prep ladder, and prep ladder simultaneously I was not studying for my NEET PG exam, just I was working and was my doing some of my side hustles.
okay. So what about your mental health journey? Even your roommates and close ones didn't know this.
Actually, this is somewhat deep.
Yeah.
In my second year, I was diagnosed with tension headache, and uh, that was very tough for me. I used to get severe, frequent headaches in the occipital region, which I was not okay with it. In my third year, I was diagnosed with severe depression and migraine, but but my only my parents knew. My roommates even didn't knew. I didn't told anyone, and I again consulted a psychiatrist. Somehow slowed my journey, but nevertheless, I have never taken any break from my schedule. I used to study somewhat less hours, but I used to study. In that phase of depression and migraine, I cleared hemat-onco, which comes in final year subject in medicine, which I studied everything from it. Hemat-onco, I still remember Philadelphia chromosome and all that. I used to study completely. And in my internship, I was again diagnosed with severe migraine, which I got again severe migraine headaches. Right. So that was somewhat deep. And I consulted psychiatrist again, withdrew my medicines, took medicines, changed some of my lifestyle, but nevertheless, our mental health got shake. But still, I used to study a lot. I used to give my part daily. I used to show up daily, every single day. This was what I did in my life, right? So I
Yeah.
used to suggest to all my juniors, whatever thing is going on in life, whatever personally, physically, mentally, emotionally, you should show up every single day in your dreams. That's my main motto, and that's I want to share this message to each and everyone out there.
Okay. So why do you think medical students still hesitate to talk about the mental health?
I basically, there are main 4 points which I think. First of all is fear of being labeled. A lot of students worry, what will my seniors think? Will it affect my career? Will I be as someone who can't handle pressure? This fear alone stops people from opening up. Second one is lack of safe spaces in medical colleges, especially. Third is the culture of being strong. Medicine still glorifies this idea that you must be tough, sleepless, and always in control. So admitting this mental health struggles feels like admitting weaknesses, which no one talks about, and you feel judged. And the fourth one is what I think is the irony of the profession. That irony, right? That we basically diagnose with study mental health, diagnose it and treat it, but struggle to talk about it ourselves, right? Because our system still treats doctors like machines, not as humans.
Okay. So if someone listening right now secretly is struggling like you did, what would you tell them?
I will be very vulnerable here because someone who is watching this might be going through the same thing, and this is the whole purpose of saying it. Nobody likes to talk about their mental weaknesses. Nobody likes to talk about their what mental health failures they are going through. So I would like to tell them, take the first step, consult a psychologist or psychiatrist, or talk to your open ones, talk to your near ones. You should talk it, and you should not be fearful, and just take rest, get back, uh, take care of your mental, and just get back what you were doing it, right? I have seen every person suffers from mental health struggles in MBBS or in residency. So we have to basically be mentally way stronger, right? Which is what I did.
Okay. So apart from doing your job and continuously preparing for the exams, what all things were you interested in? Like you told like you have started your Insta page and all. So what made you start it?
Actually, we used to study from I did majorly preparation from my Marrow, right? And there were huge notes. We used to study a lot, right? For revising, we basically like many of things, right? We didn't revise it ASAP. We don't get things ASAP. So which I felt that medical students are lacking it. And I made my Instagram page named Pacemaker. I don't have any great followers. That's a different story. But
Hmm.
I did make that page, and I used to post it. I used to post it. Some of my friends and some of my friends of friends were liking it, so I was posting it daily, and that become my main thing, to post a good content. For posting a good content, I need to study it. So that's how I make my page, and my friends did like it, and some of NEET PG MCQs even came from my page directly, right? I used to short it, concise it in a very beautiful way. Right now, my niche of page has somewhat been changed. My idea has changed. I used to post about recent updates and all that, and some of about drugs, the guidelines which I used to post. And my niche has been changed, and I like it. And I used to post about real recent MCQs also, recent updates and recent MCQs. I used to post in a very different way, which are not been seen in Maro, right?
Okay. So let's talk about your transition from choosing a clinical branch to a non-clinical branch. Why did you choose MD pharmacology?
From I still miss I left DNB Medicine. I still miss somewhat my clinical journey, somewhat talking with patients. But I chose MD Pharmacology because I have always been curious about how the drugs work, right? Not way of prescribing it. I love the science behind mechanisms, research, receptors, improving treatment systems. adverse events is to talk about it, and I love that branch. So I choose MD pharmacology as my main thing. In other clinicals, I didn't like much of pathology. I didn't like pathology. I didn't like community medicine. So pharmacology is a very good scope. So I choose MD pharmacology.
Okay, so can you please throw some light on MD pharmacology as a branch?
See, in MD pharmacology, 3 years you need to study for department used to be like 9 to 5, and in MD pharmacology you have to create dissertation as in every subject protocols, and you study about the recent articles, recent updates. You need to do prescription audit, you need to do ADR reportings, and you need to take practicals of the UGs, you need to take practicals of the MLTs and all, and you need to take practicals and theory lectures of second year MBBS students, right?
Yeah.
So, and the main thing is I love the subject, and main thing is still 9 to 5, right? This is the best part. So I love that. And after MD pharmacology, there are two scopes. Either you can go for academics, you can start associate and become AP, studying from AP, and you can go to industry. In industry, you can go in pharmacovigilance, you can go in medical writing, you can go in regional medical advisor, or either you can go for an MBA. Even I have seen lot of my seniors who have done MBA, a 2 years MBA, or even six months MBA, whatever you want to do. And even I even got offer from ISB for doing MBA, which I didn't grab it. So, and you can even go for DM clinical pharmacology, or you can none other less you can go for entrepreneurship. Is what you can do. I have seen even you can work in this big tech companies which you have saw, DAMS, Prep Ladder, Marrow. You can do a lot of things as an MD pharmacology. Best part is you are free after 9 to 5. You can do whatever you want to do after 5. This is the best part.
Okay. So after failure, quitting, criticism, depression, and finally finding your path, what does success mean to you now?
For me, success is no longer a rank or a degree, first of all. Success means now waking up and feeling aligned with what I am doing. It means peace, clarity, and a choose to my own path, even when it looks unconventional to others, right? So, success means what you are doing and what you love, what you enjoy, how your journey is. It's in way what I feel.
Okay. So what is your end goal in life?
First of all, to not to hurt people, to create legacy and to remain in heart of the people, because whatever we are doing it will be left behind, right? So and my passion is to become an entrepreneur, and I want to become an entrepreneur in life, and I want to create such a healthcare startup where I can make the lives of the people much easier, right? This is my main fund of life, right? And I want to be one of the finest even entrepreneurs of this country, this healthcare entrepreneurs. And I want to help the Indian people how they are getting food in terms of health. So I want to have such a, I want to create that awareness, and I want to help really Indian people, right? And want to
Okay.
become one of the finest entrepreneurs. That's my main goal of my life.
So how you got to know about the Salaah Shots?
Salaah Shots I have from my Instagram page, to be very honest, and where the Salahkars come and give advices which really need them, which many of the students, juniors really need that. And I think it's one of the very best platform, very best thing Sagar and Darshika are doing it. And I think you should really help people which really need their help. The people are not approaching. That's the main problem. I think people, more and more people should approach it and find out their own salakar, what they want, and really give one of the best piece of advice.
Yeah, thank you so much, Poojan. So now we'll do a rapid fire round where you just have to answer your questions in just one line. Okay. So we'll
Sure.
start with this one. One line for my biggest turning point was.
My biggest turning point was when I left DNB Medicine seat.
Okay. So one thing I wish every medico understood about mental health.
Open up, to really open up to the people, to really ask for help. When you really need help, you should just go up and show your face and ask for help. That's the main thing what I think.
The most misunderstood part of my story is.
Quitting DNB Medicine and want to become an entrepreneur.
If I hadn't trusted my own decision to quit, today I would be.
But I would be suffering, just doing things which I don't wanted to do in my life. As simple as that.
The boldest decision I ever made was.
The bold decision to become an to quit DNB medicine, it was my bold decision. My father is surgeon, right? So what this is what I have done.
Okay. So, one message to the students scared of society's judgment.
Don't take society's pressures. If you work according to society's pressures, you are really gonna be behind from society because society is defining you. You should really do what your heart says. Rest apart, don't take any judgment seriously. Don't take any of the advices seriously. Do what your heart says. Rest everything. Society will also, when you become successful, society will always figure out because you are gonna define the society, right? So do what your heart says. That's the main piece of advice.
If I could talk to my depressed third year self, I would say,
Sluggish, not self-aware.
okay, success for me today means,
For me, as an entrepreneur and what I want to do in life, that's my main
yeah, I'll repeat the question again. Success for me today means,
success
success
for
for
me.
me. Yeah,
Success for me today means what I want to do in my life. That's success for me, and I'm daily perceiving what dream I want to become. Right, this is thing
my dream beyond medicine is.
to become entrepreneur. So in my drop year, I used to study just for 8 hours. I can't study more than that. And so my father is a surgeon. So I used to sit in his OPD, seeing patients, studying, morning to evening. I used to do this, and that was my routine. In evening, I used to meet my friends. I used to stand with him in the OT, and lot of his friends were asking, "What you are doing? Go and study." But I can't study for more than 8 hours, 8 to 9 hours. That was my limitation. That is over. That is for me now. I can't study for more than that, right? So I did after a drop year also I did apart from studying. I just got interest in entrepreneurship. I read some of the various startup books. I got interested in some of the stock market, some of the stocks, and every medical should learn this. I also this is one of the finest good second source of income you can really make. That's my one piece of advice more, right? So don't go behind the jobs. Create your own impact. Create your own journey. Rest everything will fall apart. Don't worry about that.
So, being a son of a surgeon, do you also face the pressure like I have to become my father and all?
To be
And what
very
was your
honest,
support from your family?
my father was I was getting Ames Delhi general surgery, I guess. And my father, I talked with him and I was very sure that I don't want to be surgeon, right? I have seen his life. And I told him I don't want to surgeon. And he said, okay, don't be a surgeon. Then what will you do? Then I chose the medicine. Medicine will be okay for me. And when I quit medicine, he was shocked. You said you were not doing medicine and all that. And somehow he's accepted it. My family's accepted it, what I want to do. So and there are some plus minus happens with fathers, but ultimately they're happy. And even more than that, I'm happy.
Yeah, that's very good. So, thank you, Dr. Poojan, for reminding us that the success is not just a straight line. Your journey from depression to discipline, from quitting to rebuilding, from ranks to reinvention is a proof that the bravest thing in a medico can do is choose the right path, not the expected one. To everyone listening, your dreams are valid, your pace is personal, and your life is not defined by society's timeline. This is Salaah Shots, turning real struggles into real strength. So, thank you once again, Dr. Poojan, for joining us.